Well, thank you. My name is Carlijn Gerrits, dietitian at the Radboud UMC in the Netherlands. And today I'm going to take you a little bit to the ketogenic diet in the Netherlands. A little bit of the landscape of the Netherlands. So we have approximately 17.5 million citizens. And just for fun to know, even more bikes than citizens. And for all those people, we have 69 hospital organizations, of which are 8 academic and 2 a special epilepsy specialized center. And in total, we have 7 service centers for the ketogenic diet throughout the country. Within the Netherlands, we do have a collaborative ketogenic diet. And here the 7 centers communicate with each other, and every center has a dietitian, a specialized nurse, and a children neurologist, and thereby also a metabolic doctor to support us. Every center does have its own approach and its own location. And on the picture, you also see our Belgian colleagues, the Dutch-speaking Belgian colleagues. So we are collaborating every day a bit more with Belgium. We all work with the National Care Path for the ketogenic diet for children with epilepsy and metabolic disorders. That is from 2015, so probably needs a little bit of revision due to all the research, development, and the increase of experience and expertise, of course. And in the Netherlands, we have 21 dietitians, and we start up about 90 to 100 patients a year together. The varies is between 6 and 40 patients per center, so it's quite widely spread, I think. But when we look at the numbers, it's only 10% of the estimated total of patients who might be beneficial from the ketogenic diet therapy. Mostly there is an outpatient initiation of the ketogenic diet, and what we also see is an upcoming adult service. As you saw in the previous slide, most centers only treat children. Only one center treats adults for epilepsy with the ketogenic diet, but we also do treat people with metabolic disorders with the ketogenic diet. What kind of diet do we use? Well, most diets are used in the Netherlands, but mostly we do see the classical calculated ketogenic diet, example 4-to-1 or 3-to-1, but also MCT diet and the modified Atkins diet. But actually all variations on above, whatever works for patients and families is what's most important. And when the diet is effective, it's okay if it's not all by the guidelines. Well, last year was quite some kind of year. Despite of the COVID-19, we did keep busy. There are a couple of things that I would like to talk you through to talk a little bit about and show you what we have done last year. One of the most important things to me is that we're trying to start up our ketogenic dietitian network for medical ketogenic diet therapy in advance on the Dutch collaboration of the ketogenic diet. One of the reasons for that is the increasing visibility of our expertise within the Netherlands as an important aim, because we do see a lot of increased applications of some kind of ketogenic diets and all kind of variations on it. What isn't really a ketogenic diet? There are no ketones. It's meant to lose weight. It's only carbohydrate restricted. And that is pretty confusing for patients and parents when they are trying to find good information. So therefore, we are defining the difference between the proven medical indications and the correct way and ranges for the ketogenic diet therapy, so that the difference is clear for everyone. Also, in research and studies and articles, we do see the confusion. So maybe you recognize it, or is it something to look at? Also, since September 2020, they started the Matthew Friends for the Netherlands and Vlaanderen, which is the Dutch-speaking part of Belgium. And on the board, we have 3 very experienced dietitians, and as a medical board, 2 professors of children neurology, and both the Dutch and the Belgian colleagues are represented. And the mission is to have more attention for the ketogenic diet therapy as a treatment option for the medical indications, but it's also offering reliable information for a well-founded choice. So in the future, they're also hoping to support more scientific research. And in the future, you will be able to visit their website for Dutch language information. One of the theses done in the Netherlands last year was the intervention in childhood epilepsy and pharmacotherapy ketogenic diet by Dr. Amarens Weyenberg. She's a children neurologist at SIGN. And she, as a part of her thesis, she investigated the effect of a liquid start of the ketogenic diet therapy in patients who continue to have epileptic seizures despite of their medications. And one of the things she found was that ketogenic diet therapy still is an effective treatment for the epilepsy. That's not a real surprise, I suppose. But what you also found that the liquid start made it possible to get a stable ketosis quite quickly. So therefore, she hoped to find to evaluate the ketogenic diet therapy as a treatment a bit earlier than the 3 months we mostly see. With some patients, it was possible, and some other still needed a bit of time to evaluate the diet fairly. The next one is the ketogenic diet therapy thesis of Alice van der Lauw. She is a ketogenic dietitian at Erasmus MC in Rotterdam. And in November 2020, she defended her thesis. And she investigated how outcome and management of ketogenic diet therapy can be improved by finding predictors of successful treatments. She found not a very stable tool to determine the outcome, but also applications of ketogenic diet therapy in different groups, such as very young infants or parental administration, but also exploring safety and feasibility within quite new indications or quite new groups, such as during pregnancy with epilepsy and in oncology treating both children and adults with malignant brain tumors. The next research is the ketogenic diet therapy in mitochondrial disease. Here her thesis is about the nutritional assessment and dietary interventions in adults with mitochondrial disease. And as a part of the investigation, the ketogenic diet for mitochondrial disease with a systematic review on efficacy and safety. Both the dietitians worked on that. And what she found was that data is too scarce for a general recommendation. There were only a couple of patients reported, and the outcome varied. It should be considered in individuals with mitochondrial disease and therapy refractory epilepsy, but also some patients with a DNA deletion seems to be a contraindication. When considering ketogenic diet for this group, it's important to take into account the both adverse effects as also spectacular improvements in individual cases. So look at it for every case. And in the following slide, you see that she not only did a systematic review, but also is working on a prospective single-arm trial called KETOME study, ketogenic diet therapy for mitochondrial disease. And the aim is to learn how the safety and efficacy and feasibility of ketogenic diet is for this group of patients. And in this research, we're working with 20 adult patients with a genetically proven mitochondrial disease with muscle involvement, and they all start a modified Atkins diet for 12 weeks with measurements before and after. This study is still in progress, so there is no outcome to learn from yet. Also, the McArdle disease, also known as the glycogen storage disease 5, we know ketogenic diet can be beneficial for. With the questionnaire research, we want to report and learn a bit more about the experience of any form of ketogenic diet within this group of patients with a confirmed McArdle disease, and hoping to learn a bit more about how beneficial it is for this group and how they apply the diet. Something else what is quite unique for the ketogenic diet world as we know it is the individual coaching by Alice van der Lauw. She started up a coaching trial for dietitians with the aim to train colleagues, dietitians, and learning a bit more about ketogenic diet to how to for the right approach and a good management and fine-tuning, follow-up, everything related to the ketogenic diet. Since not everybody has a lot of experience or a lot of colleagues. And also abroad, she has coached a couple of colleagues. So I think it's wonderful to learn a bit more from each other. In the hospital in Rotterdam, they started up Keto Plaza. It's a digital platform for patients and their parents and families on a ketogenic diet. Basically, it's everything you need for the ketogenic diet practice at one place. It's a collaboration of the hospital with a company for medical food supplies. And when parents are considering the ketogenic diet therapy, they are allowed to visit Portal 1 for the orientation on the diet therapy. As they move forward and are going to start or have already started, they are transferring to Portal 2, where there is a possibility to communicate with the keto team, exchange informations, but they also find standardized letters and protocols for when you're going on a holiday or for a checkup at the local hospital, for lab instructions, and also standardized registration possibilities for effects and side effects of the diet. So this helps the administration load for the team and thereby lower costs, but it's also easier to do research in the future. So hopefully the Keto Plaza works well and helps in the service of the ketogenic diet therapy, so the rest of the Netherlands will be able to work with Keto Plaza maybe one day. We all had to deal with the COVID-19, and also within the keto, we found delay in the hospitalized initiation of the ketogenic diet therapy. But fortunately, most of the patients are an outpatient initiation where what was continued or had a slight delay. So at the end of the day, most patients who wanted or should start the diet could start the diets. But we do notice that the development of the digital applications accelerated. There are a lot of opportunities. We are all getting a lot more used to the video calls and digital care, working on such long distances. We already did before, but with the possibilities and the experience we have now, I think it will be getting a lot more easy to be in contact with each other, with our patients, but as well with our colleagues. So I found myself. We all knew our telephone and we all knew video calls, but it made it a bit more easier and more accepted also. Everybody has learned to work with it. So that is a bit of growth COVID-19 brought, I think. I hope you learned a little bit more about the ketogenic diet developments in the Netherlands and how we work together with the different teams. And a special thanks to my colleagues from the Dutch Collaborative Ketogenic Diet for sharing all the information. Thank you.